Hello, and welcome back. America is facing a mental health crisis. Wait times for a therapist can stretch for months, costs are prohibitive, and the stigma, while lessening, still exists. But what if the solution wasn't another human therapist, but a line of code? In 2026, artificial intelligence is stepping out of the lab and into the most personal space of our lives, our minds. From AI chatbots offering 24/7 support to sophisticated algorithms predicting relapse, technology is rapidly transforming how Americans access and receive mental health care. This isn't science fiction anymore. It's a rapidly evolving reality that promises to democratize therapy, but also raises profound ethical and safety questions. This video will explore the rise of the AI therapist. We'll look at the technology that is making personalized mental health possible, the incredible benefits of instant, affordable care, and the critical dangers of trusting your deepest thoughts to an algorithm. Before we continue, I want to ask you something. Did you know that over 95% of people who watch our videos aren't subscribed? We totally understand that life gets busy, and sometimes it's easy to forget. But subscribing is completely free, and it helps us keep creating the content you care about. So please, take just a second, hit that subscribe button, and join our growing community. Together, we can keep these important conversations alive. The problem, why AI is needed now. To understand the AI revolution in mental health, we must first understand the scale of the crisis. In the US, millions of adults report symptoms of anxiety and depression, yet the supply of qualified mental health professionals simply cannot meet the demand. This is known as the treatment gap. For many Americans, especially those in rural areas or those with limited income, traditional therapy is inaccessible. The average cost of a single session can be over $150, and finding a therapist who accepts your insurance and is taking new patients is a Herculean task. This gap is where AI is finding its footing. AI tools offer scalability, affordability, and anonymity, three things the traditional system struggles to provide. AI's first wave, the chatbots and digital companions. The most visible face of AI in mental health is the therapeutic chatbot. Apps like Wobot and Replika have millions of users, offering cognitive behavioral therapy (CBT) techniques, mood tracking, and emotional support 24 hours a day. These tools are not meant to replace human therapists, but to serve as a crucial first line of defense. They can help users manage mild to moderate symptoms, practice coping skills, and provide a judgment-free space to vent. Their effectiveness lies in their consistency and accessibility. For someone experiencing a panic attack at 3 a.m., a chatbot is available immediately, offering guided breathing exercises and grounding techniques. However, the key challenge here is the therapeutic alliance. The bond of trust and empathy between a human therapist and patient is often the most healing component of therapy. Can an algorithm truly replicate empathy? The current consensus is no, but they are becoming increasingly sophisticated at simulating it, which is enough for many users seeking basic support. AI's second wave, precision and prediction. The real power of AI lies in its ability to process massive amounts of data to achieve precision mental health. This is where the technology moves beyond simple conversation. AI algorithms are now being used to analyze speech patterns, text messages, social media activity, and even biometric data from wearables to identify subtle changes in behavior that precede a mental health crisis. For example, a sudden drop in physical activity combined with a change in the tone of text messages could trigger an alert for a patient at risk of a depressive episode. Furthermore, AI is helping to personalize treatment by analyzing a patient's genetic markers, brain scans, and response to previous medications. AI can help doctors select the most effective antidepressant or therapy modality, dramatically reducing the painful trial-and-error process that currently plagues psychiatric care. This level of personalization is a game-changer, moving mental health from a one-size-fits-all approach to a truly individualized science. The ethical minefield, privacy and safety. The integration of AI into mental health is an ethical minefield. The most pressing concern is data privacy. When you share your deepest fears and most vulnerable moments with an AI, where does that data go? Who owns it? And how is it protected from hackers or third-party advertisers? The sensitive nature of mental health data requires the highest level of security and transparency, and the industry is struggling to keep pace with the technology. Another critical issue is safety and liability. What happens when an AI chatbot fails to recognize a severe crisis, or worse, gives harmful advice? If a patient acts on flawed algorithmic advice, who is responsible? The developer, the platform, the supervising clinician. Clear regulatory frameworks are desperately needed to define the boundaries of AI's role and ensure patient safety. The future of the human therapist. Does the rise of the AI therapist mean the end of the human one? Absolutely not. Instead, AI is poised to become the ultimate co-pilot for clinicians. AI can handle the administrative burden, scheduling, billing, and note-taking, freeing up the human therapist to focus on the core work of healing. More importantly, AI can process complex data from wearables and patient journals, providing the therapist with a comprehensive, objective view of the patient's life outside the session. This allows the human therapist to move past basic data collection and focus on complex trauma, nuanced emotional processing, and building that essential therapeutic alliance. The future is likely a hybrid model, where AI handles the routine and data-heavy tasks, and humans handle the complex, empathetic, and crisis-driven care. Conclusion: a more accessible future. The AI revolution in mental health is a double-edged sword. It offers the unprecedented promise of making mental health care accessible, affordable, and personalized for millions of Americans who have been underserved by the traditional system. It has the potential to save lives by predicting crises before they happen. However, this progress must be tempered with caution. We must demand transparency, robust data protection, and clear ethical guidelines. The goal is not to replace human connection with cold algorithms, but to use technology to augment care, bridge the treatment gap, and ensure that no American has to suffer in silence because they cannot afford or access the help they need. Thank you for watching. If you found this discussion on the future of therapy insightful, please hit the like button and subscribe.